Welcome back to the Law Factor Live. With me, Dr. Alper, standing in for Delia Dolor, who is representing MAC Cosmetics in Aruba tonight. The alarming statistics to follow would suggest that almost all physicians who have written and continue to write a similar script to Dr. Conrad Murray, physician to the late Michael Jackson, every day in the US, 2,500 youth between the ages of 12 to 17 abuse a prescription pain reliever for the first time. Prescription drug abuse, as we said earlier, whilst most prevalent in the US, still remains a very big problem in other parts around the world, including the Caribbean. In the US alone, more than 15 million people abuse prescription drugs, more than the combined number who reported abusing cocaine, hallucinogens, inhalants, and heroin. In 2006 in the United States, 2.6 million people abused prescription drugs for the first time. Prescription drug abuse causes the largest percentage of deaths from drug overdosing, over 22,400 overdose deaths in the US in 2005. Opioid painkillers being the most commonly found drug. Depressants and opioids, antidepressants, are responsible for more overdose deaths, at least 45%, which is far more than the 39% of cocaine, heroin, methamphetamines, and amphetamines combined. Angus, I have you here, and it's not by coincidence that you find yourself here, and not because you are always readily available. Prescription drug abuse, and I had to do a show along those lines. For many reasons, reasons well known to you. I mean, we work from the same practice in a very complex part of the island, because complex in a sense because we have a number of expats. We see individuals from all walks of life. We see a lot of tourists and individuals who come in with their own set of problems. First of all, I think what we need to define for most of our viewers would be, what is prescription drug abuse? I mean, what is the difference between using a drug? When does someone go overboard in prescription drugs?
That's a question to me.
That's a question to you. I need to ask you the question. I only write the script.
Yeah. No, I suppose really it starts actually with the physician who needs to make a diagnosis of what's happening with the patient. In my experience, what happens is with painkillers, anxiety prescriptions for dealing with anxiety, and also antidepressants, as an example, which people use for obsessive compulsive disorder, also painkillers, and certainly for depression. What I've found is that prescriptions are made very easily. Now, antidepressants work well for major depression, but not for mild depression. And often mild depression is misdiagnosed as something which is clinical.
And mild depression being, I mean, sorry to butt in here, but mild depression being, I mean, how?
Well, what I'm calling mild depression really is situational depression.
Okay.
I.e. something which is triggered by an external factor.
So it's temporary.
Temporary, rather than an imbalance, a chemical imbalance in the brain. So that really, I suppose, that's where the whole thing starts. Now, what happens is that many of these medications are, in their own way, addictive. So I suppose, really, we would say that where the abuse starts, so far as the patient is concerned, is when they start using the substance beyond the period that one would expect them to use. And when they try to stop using them, then the side effects of withdrawal are so extreme that they want to continue using. So it's almost like an enforced addiction in many cases. Sometimes, of course, like benzodiazepines, for example, will create an addiction.
And benzodiazepines are drugs such as Valium and Xanax,
and that type of drug. They will create a situation where the patient becomes dependent on that substance to make them feel good, because it alters the brain chemistry to such an extent that they then can't do without it. But the issue then becomes how to deal with that, because when a client turns up to me, I find myself in a situation where there's huge denial about the fact that they ought not to be using it because, after all, it's been prescribed by someone
like myself,
like yourself, which makes it for them legitimate that they should be needing it. Unfortunately, my experience also has been that doctors they try to find the easy way out, so they prescribe over and over again, rather than saying to the client, hey, just 1 second, perhaps you need to be addressing this in a different way, either through psychotherapy or finding some alternative to the substance that you're currently using. Because the side effects the side effects can stretch all the way to death, basically. So, yeah.
I hear you, and I think one of the most salient points that you made was that it starts with us as physicians, and I'm not here to make it.
I'm not here to knock physicians.
No.
But I
would hope not, because we all work together.
Yeah.
But not that I'm here to make a case for physicians, but it really is a difficult thing, and very seldom in my profession, I've been practicing for 9-10 years now, and very seldom do I actually get to start that script sometimes. Yes. Reason being, a number of patients come in and they already have that problem because it's very easy to go doctor shopping. A number of patients have seen, let me give you a classic example, for example. We use benzodiazepines like Valium. We still use them as a muscle relaxant.
Yes.
Not with the end effect to induce sedation or perhaps as an antipsychotic, whatever the case may be. Yeah. As a muscle relaxant. But the fact is, if I tell you take 1 tab of Valium nightly, and nightly because it's going to cause sedation, and you find that, oh, I actually had a little insomnia, and this actually worked pretty well.
Yes.
Suddenly you have a back pain which no longer goes away. The difficulty with physicians is to look at a patient and say to you, hey, listen to me, you really don't have that sort of pain. Yeah. And there's also an economical side to it, which we'll come to afterwards, because I don't want to jump the gun just yet. But, I look at patients all the time, and I look at the prescriptions I write, and I say to myself, my gosh, what am I really doing? But I'm really in operating between a rock and a hard place, if you understand what I'm saying. And sometimes I empathize with you, because the buck sometimes has to stop at you, because you're the one who now has to help that patient out of that. I was talking to a group of perhaps the most prominent individuals in the society the other day, and believe it or not, 95% of them had no idea that such a problem even existed, prescription drug abuse. Okay. Amazingly.
Certainly does.
The next question which they asked me, and I brought it here to you, was, can anyone, in you and I, become a prescription drug abuser?
Of course. Because it's, we start using a substance. When we use that particular substance, whatever it is that has been prescribed, for example, suppose it's a serotonin reuptake inhibitor, as an example, which means that you allow the brain to be the medication allows the brain to be more flooded with serotonin.
And just for the benefit of our patients, let's say an SSRI or serotonin reuptake inhibitor would be drugs like Paxil or the antidepressants, for example. The antidepressants, so the drugs would make you feel really well.
There's a feel-good factor to them. When the patient stops taking those, or if the patient attempts to stop taking them, first of all, you have to take them, you have to reduce them. You can't simply stop them, because that's actually quite dangerous.
Precisely.
But what tends to happen is that the brain becomes conditioned to the existence of that amount of serotonin. And that amount of serotonin is no longer naturally released, and therefore you have this thing where there is a deficit of serotonin. Correct. So the body screens for another pill, and unfortunately, what tends to happen is that other pill is prescribed.
So essentially, you're saying that any of us could become a prescription drug abuser today?
Very easily.
Wow. We must take a break in a short while, but after the break, we'll come back and I have some more statistics. I also have some more questions because I need to clear the air on this. And you understand my position. I'm a physician, and I work with you, and you know, we want to get this right, or as right as we can, as right as is permissible. We'll go to a break right now, and we will be back after. Yeah. As we go to a break, one of our reminders from our giveaway from MAC Cosmetics, compliments of DFL. Gift entries end at 9, but until then, you can enter by telling us which country is DFL's host, Deal Your Dollar in tonight, and which sponsor is she representing. This is the Dollar Factor Live. We'll be back after the break. Thank you. Well,